Hello ladies, my name is Jaylene Sims and I'm a medical student at Southern Illinois University School of Medicine. Welcome to the Love Your Life series. Today we're going to talk about heart health. The lesson is entitled, Love Your Heart. Now here's the eye-opener. More women die from heart disease than any other disease. We think of heart disease as being something that's more common among men. However, more women actually die from heart disease than men every single year. The signs of heart disease are different for women and men. So for women, sometimes they go unrecognized or they get attributed to other health problems. Because of that, the purpose of this session is to heighten the awareness of the signs and symptoms of heart disease, inform women how to prevent heart disease and heart attacks. Why? Because women are the strength, the heart, and the soul of their families. As you can see here at the bottom of the slide, I have a heart that's lifting weights. That signifies us as very strong women. Let's talk a little bit about the function and the anatomy of the heart. Now the top part of the heart is the atria. It receives blood from the body and the lungs. From there, the blood flows into the ventricles, which then pumps the blood to the body. Now if you look at the pink area, the left side is a little more thicker than the right side. The left side of the heart pumps the blood to the whole entire body, while the right side of the heart pumps the blood to the lungs in order for it to get oxygen. Now, because of the heart's pumping duties, the heart needs regular exercise just like the other muscles in our bodies. Not only does the heart pump blood to the body, but it pumps it to itself. The heart gets its own blood supply, which provides oxygen and energy to the heart to help it keep working the way that it's supposed to. So what is a heart attack? A heart attack is when the blood supply to the heart gets blocked and it causes damage to the heart wall and the muscle. This could be due to a clot or fat buildup in the walls of the vessels. I'd like to take your attention to the picture at the bottom of this slide. The top picture is a healthy artery. There's nothing in there that's stopping the blood flow or decreasing the blood flow to wherever that artery is headed. Now the bottom picture is a partially blocked artery. That yellow thing in there is called a plaque, which is a buildup of cholesterol. As you may think, this is decreasing the blood flow to wherever that blood is glowing. Now if this was in the heart, it could cause chest pain or a heart attack. Now let's say a piece of that plaque breaks off and causes a clot in the brain and blocks the blood flow. What would that be called? That's right, it would be called a stroke. Now say a piece of that breaks off and it lodges in the heart and causes a blockage of the blood flow. What would that be called? You're absolutely right, that will be called a heart attack. Now that we know what a heart attack is, let's talk about a few of the risk factors for heart disease and heart attacks. Metabolic syndrome is a group of risk factors or medical disorders that puts a person at higher risk for heart disease and or diabetes. There are several different risk factors that lead to metabolic syndrome. However, you only need 3 of these in order to be considered to have metabolic syndrome. High blood pressure. It makes the heart have to work harder than it's used to in order to pump the blood through the body. It's kind of like running up a hill opposed to running on flat ground. High LDL cholesterol. LDL cholesterol is a fat that clogs the arteries and decreases the blood supply to different areas of the body. It's kind of like that plaque that we saw on the last slide. How I remember LDL cholesterol is I say L stands for lousy, L stands for low down. So our LDL cholesterol is the bad cholesterol. Low HDL cholesterol is another risk factor. HDL cholesterol is our good cholesterol that protects our heart and our vessels from damage. It prevents that yellow plaque that we saw on the last slide. How I remember this is I say H stands for heaven and heaven is good. So our HDL cholesterol is our good cholesterol. Therefore, if it's low, that becomes a risk factor. High blood sugar or having diabetes. That can cause damage to your arteries and your nerves. The last risk factor we'll talk about is increased waist size or obesity. This can make it difficult for your body to function the way that it's supposed to. Now that we've talked about metabolic syndrome, let's talk about two of the other risk factors. Mental stress and depression. Stress can increase your blood pressure, and it kind of goes back to what we talked about with the high blood pressure. Sedentary lifestyle. Sedentary is the same thing as saying being physically inactive or saying someone is a couch potato. Staying active will help you lose or maintain your weight. And since your heart is a muscle, it'll also condition your heart. The last risk factor we'll talk about is smoking. Smoking puts toxins in your body that damages the normal protective properties of your body. Therefore, it's important to quit smoking if you actually are a smoker. Now let's talk about the signs of heart disease and heart attacks. Now, if you can remember, we said that women's symptoms are a little different than men, so that's why I want to make sure that you all know what the differences are. Men usually have a crushing or a tightness in the middle of their chest. Sometimes they describe it as like an elephant standing on their chest. Sometimes it'll move to the left shoulder or the jaw. And sometimes they'll experience sweating. Now, for women, they're just a tad bit different, or we can also say they're atypical. Women can have pain at rest or when active. The pain can be considered tightness or squeezing or pressure. And one woman that I spoke to said that when she had a heart attack, it was a burning pain. This pain can be located in the chest or the stomach, the arm, the jaw, the neck, the shoulder, or the back. You could also experience shortness of breath when you're resting or when you're active. You can also experience a racing heart, or sometimes your doctor may call it heart palpitations. You can also experience sweating or unusual fatigue. Speaking of the stomach, for the pain, a woman could also experience nausea, vomiting, or gas. Now that you know a little bit more about heart attacks and heart disease, let's talk about how to prevent heart attacks and heart disease. Diet is very important to help you maintain or lose weight, and it's also important if you want to just maintain a healthy lifestyle. It's very important to have a nice balance between fruit, vegetables, and protein. I want to teach the plate method. Now, this plate method is very common among diabetic patients. However, I think it's a very nice visual to provide anyone with the ability to make a plate or to just balance their diet very well. Half of the plate should be non-starchy vegetables and fruit. Non-starchy vegetables includes things like greens, green beans, carrots, broccoli, salad, cauliflower, and spinach. A fourth of the plate should consist of protein. Protein would include things like chicken, beef, pork, turkey, fish, or beans. Now, one thing to be aware of is that when you have beans for your protein, you have to realize that beans are also starchy foods. Now, the last quarter of your plate is supposed to be your starchy foods, your breads, and your grains. So if you have beans for your protein, you'll have to take away from the starchy corner of the plate. Now, starchy vegetables would include things like peas, corn, or potatoes. And then your grains would be like your pastas and your rices and your dinner rolls. One suggestion for your grains is to try to have whole grains. Those are considered to be more healthy. Now that you know how to make your plate, say for instance if you go out to eat or something, let's talk about a couple other things that we want to make sure you do while you're taking care of your diet. Do away with the salt. Another word for salt when you're looking on the cans or different labels is sodium. Try to get things that say low sodium, or if you're trying to compare different types of foods, look on the labels and see how many milligrams or grams of sodium there are and try to choose the one that has the least amount. The next step is to do away with the soda pop or the sweet tea or the Gatorades or the things that have lots of calories in them. Those are just liquid calories. You're only supposed to have a certain amount of calories every single day. And so the way I think of it is I'd like to try to have more water, which is 0 calories, opposed to like the teas and soda pops, which takes away from the amount of actual food that's more nutritious for my body that I can have each day. The last step is to increase your water intake. Try to have at the very least 8 8-ounce glasses of water every single day. Here are a few more ways to prevent heart disease. Exercise. Get moving. It doesn't matter what you do, just make sure you get your heart rate up and stay active. You can walk or run, dance, do yard work. Yard work would consist of things like mowing the lawn, shoveling snow, raking the leaves, and then you can also do housework, which will keep you active as well. Running up and down the stairs, dusting, and sweeping the floor. Those are all great things to keep you active. A few other suggestions would be to park far from the store or the mall and walk in. Another way is to use the stairs if it's feasible for you, instead of using the elevator or the escalator. Now, if you haven't been exercising, make sure you start small. You can start at 10 minutes, then move to 15, then go to 20. But what you want to do is work your way up to at least 30 minutes of continuous exercise 3 to 5 days out of the week. Stress management is very important for prevention. Do something that makes you happy and something that makes you relaxed. Listen to meditation music. Do deep breathing meditation. Those are two things that I really love. You can take a bubble bath or get a massage, get your hair and nails done, have a girls' night. Oh my goodness, that's a lot of fun too. Hang out with your family, things like that. The last suggestion I would say is to control your blood pressure and your cholesterol. All the above lifestyle habits that we've talked about will help you with that, but if you have medications, make sure you take them on schedule and visit your doctor regularly. Now that you have learned about heart health, here's the charge. I really like the motto, each one teach one. You know more about heart health now, and it's your responsibility to teach someone else. Teach your daughters, your aunts, your cousins, your mothers, your sisters, your girlfriends, even teach your enemies, whoever it is. Word of mouth is one of the best mechanisms to help prevent different diseases. And as you can see on the picture at the bottom, women helping women, we all have heart. Do you have questions or want copies of the information that was provided today? If so, you can email me, Jaylene Sims, at jaysloveyourlife@yahoo.com. Or if you have really serious questions, I would strongly recommend you to go see your doctor. And remember, the information that was provided today is not supposed to be substituted for the information that you can receive from your doctor. Please follow up with your doctor, ask questions, tell them what you learned, and they can make clarity out of the information you learned today. I use the Mayo Clinic to provide you with the information that I have today. If you'd like to read more about heart health, please go to the Mayo Clinic website. You can also go to CDC, or you can go to the Heart Association. There's so many different online resources that will provide you with more information if you need it. Thank you for tuning in.